Hello, this presentation is about diabetes and its effect on the kidneys. It's absolutely necessary that you know this stuff. If any of the following apply to you, then you must watch this presentation. You've just been diagnosed with diabetes, you've had diabetes for many years, you're taking medicines for diabetes, you have diabetes but you're not taking any medicines for it, or there is a family member who has diabetes. So what exactly are we talking about here? First, I'd like to ask you a few questions. Do you know about a test called urine microalbumin test? Does your doctor recommend that you get this test done every year? And does your doctor recommend that you get blood tests to assess kidney function periodically? First, let's talk about the urine microalbumin test. It's a fairly simple, straightforward test to help detect kidney damage during the very initial stages. Normally, there is not any albumin, which is one kind of a protein, in the urine. Now, when the filtering mechanism of the kidneys is damaged by high blood glucose levels or high BP, small amounts of albumin starts leaking into the urine. This is what is called microalbumin, and the test to detect the presence of microalbumin in urine is the urine microalbumin test. Everyone should know that diabetes is a major cause of kidney damage. So is high BP. High blood glucose levels, meaning uncontrolled diabetes, and uncontrolled high BP, either alone or in combination, can lead to kidney failure. It's very important to remember that until kidney damage is advanced, you will not feel any different, meaning you will not have any specific symptoms to indicate that your kidney function is being affected. How to save kidney function? Important: early detection, proper monitoring, and right treatment. So how do we do this early detection and monitoring for kidney damage? Important to remember is that urine microalbumin test that we talked about a few slides ago. Basically, this is a very cheap, simple and effective test for detecting early kidney damage, and you will not have to collect urine for a 24-hour period. One urine sample is enough. And everyone with diabetes should get this test done at least once a year. This is extremely important to know and remember. And blood tests for estimation of kidney function, the one test that we talk about is serum creatinine. And based upon this and certain other values, your GFR or kidney function is estimated, and that is something that is done by the lab, and this test should be done as advised by your physician. You will need to ask your doctor about the normal, abnormal and danger zone levels for these tests. So if you did the tests and the results are abnormal, your physician will of course need to sit with you and discuss the treatment plan. So what is the right treatment? Once you have been diagnosed with early kidney damage or kidney damage at a later stage, there are medicines available to help control further damage. And clear guidelines have been established regarding specific medicines that your physician will discuss with you. Keep in mind that controlling high BP and high blood sugars is extremely important. In order to prevent further kidney damage, you will need to have excellent blood sugar control. So for this process and monitoring, regular testing of hemoglobin A1C that we have talked about in the type 2 diabetes presentation is an absolute must. And this test will need to be done at least once every 3 to 6 months. How to manage your diabetes effectively? changes to your lifestyle, make sure that you get all the essential tests done on a regular basis, medicines as per your doctor's advice, and of course, follow up, which is crucial. Quit smoking if you're a smoker. Absolutely essential that you do that.